Hello, everyone. Good evening. So, welcome again tonight for our Facebook Live on nursing prioritization and delegation. So, you all excited tonight for our series of questions? So, we have, or I have prepared a few questions for you tonight again for delegation and prioritization. Okay. The focus of our concept for tonight is going to be on gastrointestinal system delegation and prioritization questions. So, are you good with GI disorders, everyone? So, that will be our focus for tonight. Before anything else, I would like to introduce myself. My name is Mr. Alan Matus, and I am the nurse educator and also the president of Matus Nursing Review, and also the Matus Nursing Review online and NCLEX Academy. I have been a nurse educator for almost more than 25 years now, and I have been teaching nursing students for a long time and also helping them out past their NCLEX. So, again, thank you for joining me tonight, everyone. Okay, now let's welcome some people here tonight, especially the new ones. Let's welcome them. So, we have, let's see who's new here in the group. Okay, so let me find out. Okay, so yeah, still the same. We have Audrey. Thanks for joining us again tonight. You're always here every week. And then also we have Hilda as well. So welcome here tonight again. So hopefully you're learning a lot. Lloyd, thank you for being here tonight as well. Let's go call out some people. Shout out. Okay. So we also have Manjinder. Okay. Thanks for being here tonight. We also looking for. Okay. So we have Sujata Shrestha is a new person tonight. Okay. Then also we have other people. Okay, so we do have another person. Okay, so Kirmaljit Brar. Okay, so welcome here tonight as well. Okay, so but anyway, everyone, without further ado, let's go to our presentation for tonight. Okay, so before anything else, I would like to announce again for tonight we're very lucky because for this week again we have a free 90-day online access and NCLEX review. We do have a winner for the last session, and it's posted in our Facebook page. So whoever joins tonight will be part of the raffle that we're going to do, and then check the next day or the day after the result of the raffle so that you can see who won the free 90-day online NCLEX review. This 90-day online NCLEX review is a good deal for students. So thanks for being here tonight. And if you win, then you can experience the online NCLEX Academy that we offer. Okay. All right. So hopefully you're all excited, everybody. Can you please tell in the comment section from which country you're coming from or your location so that I could do a shout out, especially if you come from somewhere else that really very far, for example. Okay, so remember we are international. Okay, so another reminder that we have for tonight before anything else is that I started this free 1 hour NCLEX review program webinar. So we did one last Monday and then another one in July 13. And basically the purpose of this webinar is to get to know my program. You can attend this webinar and ask questions because I'll be presenting what the our program is all about. Okay, and how we can help you pass your NCLEX examination. And then also, I'll be explaining a little bit about the NCLEX test plan in this webinar, everyone. Okay, so feel free to visit our website, Matus Nursing Review, academy.com. You can go there and enroll in the program and reserve your spot. Okay, thank you. Then another one that we have, another announcement for everyone. But before that, let's see. From Bay Area, we have Erica Fernandez. She's from the Bay Area. Okay, and Jewel Brian Reyes is from the Philippines. Okay, so nice to meet you here. Then we also have, okay, so most of them are from California, from Nepal. Sujata is from Nepal, so that's really very nice. Okay, nice to see you here, guys. Okay, but anyway, thank you very much, everybody. we're going to have another announcement. And this is a big announcement, everyone. I would like to let you all know that UWorld QBanks is coming soon. I think all nursing graduates know what the UWorld QBank is all about, right? It's one of the most trusted uh, resources for the NCLEX, especially when it comes to practice questions. Okay, they provide the best question and explanations. I have scoured different resources, and I found UWorld to be the uh, the Q bank that is really offering student nurses the ability to critically think when they answer the question, and I really would like to let you know this, that it has the best rationales for the test questions, and some of the rationales are visual, and that's how students learn at the same time. But the interface, the program, the that provides or offers to the student is top notch. So all nursing graduates have heard about UWorld, and no doubt this is a very good resource that we'll be offering to the student as part of the package of our program. So I'm so excited about this because finally, aside from the NCLEX quizzes that we have in the academy, students will have also the option to do practice questions, and this will be beneficial to the students who gets the package, because going through us, you'll be receiving the UWorld. Okay, so let's proceed to the next. So I hope you're all excited about this package, everyone, because it's a very nice offer. You know, having UWorld in our program. So it's gonna be coming soon. Probably next week we have the pricing for this. Okay. All right. So I know that you're all excited, everybody. So we have, okay. So we have Marilyn. Marilyn De Flores is coming from the Philippines, and she's preparing for the Philippine National Licensure Examination. Okay, very good. All right, looking forward. Okay, so excited also. So Lloyd said he's really very excited about the UWorld program. But tonight we do have some questions for you guys. Again, two prioritization questions, and then we will have also the delegation questions. Okay? All right. Yes, Manjinder. So it's really coming, the UWorld option for everybody. Okay? And Jennifer Casido is from Hawaii. Thank you. I was there a few months ago, or I guess last year. Okay? We were in Oahu, I guess. So, and then we toured the whole island of Hawaii. And maybe one of these days I'll be coming over there to do an NCLEX review, a live classroom. Okay? So, everybody, I would like you to comment a big shout out yes in the comment section. Okay, if you're all excited for our question for tonight, it's gonna be gastrointestinal disorders. Okay, so the first question for tonight, everyone. Okay, so it's gonna be again, we're gonna be having 4 clients, and then which client comes first? Okay, all right. Okay, so let's read the question, everyone. Okay. The nurse makes rounds before the start of the morning shift. Which of the following clients need immediate intervention? Okay. A. The client with gastroesophageal reflux disease or GERD who complains of heartburn after eating. B. The client who recently underwent subtotal gastrectomy and is reporting nausea and abdominal distension. C. The client with duodenal ulcer requesting for additional foods to relieve his abdominal pain. Or D. The client with diverticulitis who complains of cramp-like pain on the left lower abdomen. Okay, so what do you think is the answer for this question, everyone? A, B, C, or D? Is it someone with GERD having a heartburn after eating? Someone with gastrectomy reporting nausea and abdominal distension? Also, duodenal ulcer asking for more foods to relieve abdominal pain? Or D, someone with a cramp-like pain because of diverticulitis, okay, on the left lower abdomen? All right, so everyone, it seems like you have finally made up your minds, guys. Okay, some of you said letter B. Okay, if you put your answers letter B, A, C, or D right now, you know this is the one thing I would like you to do now. I would like you to put your rationale for your answer. So let's see who gives the correct rationale for the answer. Okay? So put your rationale, everyone, before I proceed and give you the right answer to this question. Okay? Write your answer, everybody. Okay. So, going to this question, everyone. Okay, what's the approach to this question? So, you have four gastrointestinal disorders, and some of these disorders here, or most of them, are characterized by pain. Okay, so by pain. So, let's find out what's the answer to this question. Okay, so the answer to this question. Okay, are you sure of your answers, everyone? Okay, the answer is going to be letter B. Very good, everybody. You got the right answer. It's going to be letter B. All right. So the client with who underwent, okay, recently underwent subtotal gastrectomy and is reporting nausea and abdominal distension. So most of you said that the reason why this is a priority is because of nausea and abdominal distension. But before that, let's find out why A is not the right answer. The reason is because heartburn may be uncomfortable and we need to address that. However, heartburn is part of the symptoms of GERD and we need to address that. But unfortunately, there are more other patients or there are other patients that needs to be seen first. Okay. So letter C is not the priority patient because it's expected that when a patient has duodenal ulcer, that is the type of ulcer that is characterized by pain that is relieved by food intake. Okay. Letter D, the client with diverticulitis who complains of cramp-like pain. Remember that this is characteristic of diverticulitis, you know, the pain on the left lower quadrant. So letter D. So remember that when you're answering priority questions, you have to find out if the patient is unstable and unstable first. That's really the first thing you have to do to decide each item. Are they stable or unstable? And to find out if they're stable or unstable, you have to ask yourself, are these symptoms part of the condition? Are these symptoms indicating complications? Are these symptoms part of the symptoms or do they indicate complications? So A, C, and D do not indicate the presence of complication. Okay, but letter B does indicate that there's something going on with this patient after subtotal gastrectomy. A lot of you are saying that maybe the reason is wound evisceration or dehiscence or maybe dumping syndrome because of course when you talk about subtotal gastrectomy, a lot of you will think that dumping syndrome happens. Okay, remember that dumping syndrome happens after the patient eats. Okay, it's in letter B, it doesn't say your patient just ate and then is having nausea and abdominal distension, right? It's possible that this patient may have dumping syndrome later on when he's eating, so or after meals. But then the reason why letter B is the answer is because after subtotal gastrectomy, your patient will have a nasogastric tube. Okay, and one of our nursing responsibilities is to make sure that the nasogastric tube is patent, okay, making sure that there's no obstruction. So if the nasogastric tube is obstructed, then it affects the drainage. Okay, remember NGT is inserted for decompression or the removal of gas to prevent abdominal distension. And if abdominal distension happens because of the accumulation of fluid, that is uncomfortable. And remember, this is a post-operative patient. All right. So remember, so hopefully you got the rationale, guys. You're convinced of the rationale. Can you say yes if you think that my rationale was correct, while letter B is the answer? Okay. So say yes, everybody. Okay. Why there is nausea and abdominal distension? Okay, because of blockage of the NGT. All right. So very good, everyone. But somehow you got the correct answer, everybody. That's correct. Okay. So let's go to the next question, everybody. Are you ready, everyone? Okay. And I would like to encourage you all, this session may help you, but remember, we have done a lot of these sessions already. So go to YouTube, okay? Or when you enroll in our program, we have all of these recordings, and then all of these recordings are in our program, okay? And some of them are in the YouTube as well. So, but if you want the complete set, all of them are in our program in the academy, okay? And you can watch all of the previous sessions. So let's go to the next question. This is again going to be prioritization, okay? Are you ready, everyone? Okay, so let's proceed. Okay, the emergency room nurse is caring for a client with a presumptive diagnosis of acute appendicitis. Which of the following assessment findings require immediate attention? So this is a patient with acute appendicitis. A, pressing the left lower abdomen leads to pain on the right side. Okay. B, generalized periumbilical pain localizes to the right lower abdomen. C, sudden cessation of abdominal pain an hour after admission. D, pressing and releasing pressure from the right lower abdomen causes pain. E, a blood pressure of 140/90, heart rate of 67, respiration of 14, and temperature of 100.6 degrees Fahrenheit. So what do you think is the answer? Or select all that apply. Which of the following assessment findings require immediate attention? Meaning the most important ones. Okay? The ones that indicate something is going on with your patient. Okay, so what do you think? This is acute appendicitis. Which of the following assessment findings, okay, would require immediate attention? Okay, something that you need to be worried about. Okay, do you think this is a little bit of a difficult question, everyone? Okay, so what do you think, everybody? This is a challenging question. I know that some of you know the signs and symptoms of appendicitis, but remember, there's many symptoms in appendicitis. It's not only that one symptom that I know you are thinking right now. Okay, can you put your rational why your answer is going to be letter A, letter B, C, D, or E? Why? Okay, can you put your rational, everybody? Okay, so all of you are having answers now. I'll give you more time a little bit because it is select all that apply. The strategy to this question, everyone, is you should know the signs and symptoms of acute appendicitis. All right. So which one should you be worried? Okay, that's the question. Would require immediate attention. Okay, so kind of like a difficult question for everyone, but let's see what's your answer, everybody. Okay, all right. Okay, so go back to your books, everybody. But before that, okay, I'll give you the answer now, everyone. Okay, I think some people are answering different answers. Okay, let's see. That's very interesting. Are you all excited regarding the answer to this question? Okay, the answer to this question is going to be, let's see, one person answered letter C and E. Why? So C means sudden cessation, means rupture of appendix, and E, increase in temperature, can be a sign of rupture. Okay. All right. So let's see if he is correct. The answer to this question is going to be letter C and E. Very good, Audrey. You got the right answer. It's going to be letter C and letter E. Very good. Okay. So let's find out why is C and E the findings that require immediate attention. We all know that letter C is included because we have been taught that the sudden cessation of abdominal pain is a sign of a ruptured appendix. Very good. So we need to include letter C. But why do we include letter E? Because letter E, everything is okay there, I guess. However, the one that we're concerned about is the body temperature. It's 100.6 degrees, which indicate the presence of rupture of the appendix, that is fever. Okay, so it may indicate the presence, especially if there is a change in the body temperature, if it's increasing. Okay, so that would be, although we expect fever, but then especially if the temperature rises, then definitely we need to be aware of that. Okay, now letter A, pressing the left lower abdomen leads to a pain on the right side. That's actually a positive Robsing sign in patients with appendicitis. If you review Robsing sign in appendicitis, letter A is expected when you have acute appendicitis. Okay. Your letter B, the characteristic pain in appendicitis is that it begins generalized around the umbilicus, and then later on it localizes to the right lower abdomen. So that's kind of like expected. Okay, your letter B, that's the characteristic. Letter D, pressing and releasing pressure from the right lower abdomen causes pain. That's actually expected as well. That is your rebound tenderness, your letter D. So that leaves you with letter C and letter E, because when you have fever, you know, and then you combine that with sudden cessation of abdominal pain, then that indicates that your patient is having possible rupture of the appendix, and then peritonitis can happen as well. Okay, so very good, Audrey, for getting the right answer to this question. Okay. All right, but for those who got letter C and E, congratulations as well. Even if you included letter B, for example, always remember you need to be very familiar with the signs and symptoms of different conditions. Okay, very good. All right, so everyone, are you all ready now for our next question? This will be your delegation questions now. Okay, so let's proceed, everybody, to our delegation question. Okay. So our next question, everyone, will be select all that apply again. The nurse works with the unlicensed assistive personnel in the medical surgical unit. Which of the following tasks can be delegated to the UAP when caring for a client who underwent a subtotal gastrectomy? Select all that apply. So again, we're trying to find out which task can be delegated to the UAP. A, note the characteristics of the gastric drainage. B, provide oral hygiene. C, explain to the patient the need to be NPO. All right. Auscultate for return of bowel sounds. Or E, report passage of flatus. Okay. So which one can we delegate to the UAP? All right. Note the characteristics of gastric drainage, provide oral hygiene, explain to the patient the need to be NPO, auscultate for the return of bowel sounds, report passage of flatus. Okay. So, what is the most important strategy for this question? Always remember that when we delegate to the UAP, the first question, I always told you the three-letter S's. Scope of practice, okay? If it is a stable patient. And the last one, it has to be a simple routine. Okay, letter S, simple. Okay, so that would be the scope of practice, stable patient, and then simple routine only. Okay, nothing, okay, or not activities that require complex thinking, something that requires the critical thinking or analysis of a trained, registered, or licensed vocational nurse, right? So we need to make sure of that. So what do you think is the answer here? Anything that requires evaluation, assessment, anything that requires complex thinking, you know, we cannot have that for the UAP because that is not within their scope of practice and training. Okay, so it has to be simple. Okay, routine task only, especially activities of daily living. Okay, so the answer to this question, everyone, is going to be, okay, so the answer is going to be, the most important thing is always to think simple. Simple activities, routinary activities, stable patients within the scope of practice. Write this down, the three-letter S's. Scope of practice, stable patient, and the last one is simple only. Okay? So the correct answer, everyone, I think someone, okay, let's see. The correct answer is very good, everyone. That would be B and letter E. Very good. So the answer to this question is B and E. Congratulations, Angeli. You got it right. Very good. Okay. Who else got it right? So we also have Erica. Also, you got it right. So those people who got it right, congratulations. Okay. So Pratiksa also got it right. So remember, noting the characteristics of the gastric drainage, that is more of evaluation. You know, that requires the skill of to evaluate and analyze the skill of a licensed nurse. Okay. Letter C, explaining to the patient the need to be an NPO, that is teaching. We cannot delegate that. Auscultation, definitely that's for a licensed nurse. But provide oral hygiene, reporting passage of flatus, for example, then definitely those are simple tasks that could be reported or that could be done by the UAP. So congratulations for those people who got this question right. Okay, I'm very happy. I think most of you got the question right, everyone. Okay, very good. Okay, now let's go to our last question, everyone. Are you all ready? Okay, but before I forget, I would like to let you know, everyone, that recently we had a promo. This is a limited time offer. Okay, offer for those students who are buying our hoodies, for example, or sweatshirt in our merchandise store, will get a free 60-day online NCLEX review. Okay, hoodies and t-shirts, and we already have like lots of students who emailed me about the promo. Okay, so just show your proof of purchase. You email that to us, and we'll enroll you for free for 60 days in our online NCLEX Academy. So that's our ongoing offer right now. And we do have right now a 25% off our online NCLEX program as well. And it's ending, I guess, tomorrow, okay, the Independence Day. All right. So we have a lot of promos going on, everyone. So check our website. Okay. So let's proceed to the last question, everyone. Let's see who can answer this question again. This is select all that apply. Okay. So let's go to the question. The nurse works together with a licensed practical nurse and unlicensed assistive personnel. Which of the following tasks may be delegated to the LPN when caring for a client with gastroesophageal reflux disease? Select all that apply. So which one can be delegated to the LPN? Okay. A. Administer proton pump inhibitor drug orally. B. Reposition the client every 2 hours. C. Evaluate response to food intake. D. Measure weekly weights. Or E. Check that the meal tray has the correct foods for the prescribed diet. Okay, remember that in gastroesophageal reflux disease, we have to avoid certain foods, right? Foods that cause abdominal discomfort. Okay, so what's the answer? A, B, C, or D? Select all that apply. Okay, so which one should be, or which one can be delegated to the LPN? All right, so may be delegated to the LPN. All right? Okay. So is it A, B, C, or D? Okay, to the LPN. Remember, when the registered nurse, for example, delegates to the LPN, you never delegate EAT. What is EAT? Evaluate, assessment, and teaching. Okay, those are the three things that you do not delegate. Okay, so the answer to this question is going to be letter. Okay, so some people here, my said it's letter A and letter E. Okay, we also have Hadu, Winey, it's A and E. Okay, we also have Erica says A and E. Okay, so let's see the other people here. What's their answer? Okay, so for this question, everyone, the answer is going to be, all right, finally, everybody, I'm so happy that most of you got the right answer. Yeah, it's actually A and E. Not letter C is not included in this answer. Okay, that is just a typo, everyone. Okay, so the correct answer is going to be A and letter E. We do not answer letter C because C is evaluation. That is for the registered nurse, everybody. Okay, but letter A is included because that's your proton pump inhibitor. That's an oral medication, and that's within the scope of practice of the LPN. Um, we do not include repositioning because repositioning could be assigned to the UAP. Letter C is not included. Okay, so I would just like to make sure everyone, letter C is highlighted there, but it's not included. So it's only A and E. Letter C is for the registered nurse. Okay, letter D, measure weekly weights. That would be for the UAP. And letter E, definitely the LPN can do that to check that the meal tray has correct foods for the prescribed diet. So remember that some patients with gastroesophageal reflux disease may be on a bland diet, and it's not part of the training of the UAP to check if the patient has the correct foods on the meal tray. So congratulations for those who got the right answer. That would be letter A and what? Letter A and letter E. Okay, so very good rational, Angeli, you got it right. So B and D is for your UAP, and then C is for your RN. So always remember, when the RN delegates, remember you cannot delegate eat. Okay? So that's it. What is the best thing that you learned tonight, everyone? Can you write on the comment section what stood out today? What is the best thing you've learned tonight? What did you learn, everybody? Okay? And thank you very much for joining us. So just remember, just a very quick reminder, everyone, our announcement, starting July 18, we're doing our live comprehensive NCLEX review webinar, July 18 to September 26. That will be every Saturday from 8 a.m. to 3 p.m. So this is for nurses who have graduated a long time ago, or any nurse who needs a content review. So whatever is in our online class is going to be the same thing as the live class, everyone. And it comes with an ebook. You can join the review anywhere in the world. And also, it comes with, of course, our highly acclaimed and our flagship. Every student likes this, the workbook. Okay, the workbook that we offer to the students. And of course, at this time, we have a promo. Okay, when you enroll in our program, most of these programs now have a 1-year access. Okay, 1-year access to my lectures online. So it's really affordable. It's a very good deal for the students because we just really want to help the students at this time. Okay, especially with the COVID pandemic. Anyway, everybody, so that's our schedules. Okay, and we also have every Tuesday right now the 12-week fast track and NCLEX review. That's 7 to 10:30 p.m. as well. And you can visit our website for more information on these programs. Okay. Now, everybody, so what is the best thing that you have learned tonight? I'm going to put them here. So let's see. So Kadu said, prioritize between stable versus unstable. Very good. Never delegate it to the LPN. Yes, very good. Kadu, what else have you learned tonight, everybody? Is it informative? Erica said the 3-letter S's. Yes, Erica. Good. So the scope of practice, when you delegate to the UAP, remember the 3-letter S's. Okay? Scope of practice, a stable patient. If the patient has dysphagia, the UAP cannot feed that patient. Okay? And simple routine only. Very good. Okay? Now, one last more. What did you learn for tonight? Okay? So, so Mai said, your FB Live about delegation and prioritization is highly recommended. Really a very big help. Thank you very much for that, Mai. Okay. And then lastly, we have, okay, so we have Rich. Okay, I think most people like the 3-letter S's. Okay, stable, the scope of practice, and simple. So remember that in your NCLEX. And of course, Loretta said, familiarize yourself with the clinical symptom. Very good. That is an important strategy in the NCLEX. Okay, so again, I do have my book in Amazon, everyone. So my simple, fast, and easy NCLEX review. Okay, so if you want to learn your content, and you want to learn it in 1 week or 2 weeks, you want to have additional resource, then you can read my book as well. I do discuss there more of the delegation and prioritization. Okay, so thank you very much, everybody, for tonight. I really appreciate you being here. Okay, and I hope you like my book, Rich Rich. Okay, I hope you like it. Okay, thank you very much for that. And then when you do succeed in your NCLEX and you pass, send me a message, and I'll be very happy to know that my Facebook Live um, what's this has helped you in your NCLEX examination. And spread the word, everybody. Check the Facebook page tomorrow or the next day to whoever wins our 90-day NCLEX review, everybody. Okay, so thank you very much, everyone, and have a nice day. Nice night, okay? And be safe on your July 4th celebration, everyone. Okay? So thank you very much and keep safe, everybody.